median nerve flossing. So simple way to set this up in the gym is to use a squat rack, and then that way you can use your support beam to get the height exactly how you want it. Because a lot of us, this is really challenging to do without supporting your elbow on something. If you're not at a gym, you can use like an office chair, an office desk, adjust the height of the chair. You can use your floor and your couch at home, just something to support your elbow. So that way you're not trying to hold the weight of your arm up, but we'll go over both of those in case you have really limited equipment. So the median nerve kind of courses through our forearm and into our hand, and it originates up into our neck. We have a bunch of nerves that come out of our neck, come down through our kind of arm and shoulder, and then bifurcate or kind of spread out through my lower limb into a bunch of different nerves. And in this movement, we're talking about the median nerve. So we're going to talk about flossing and tensioning. So flossing is not as aggressive. Tensioning would be the most aggressive. So if I'm doing a median nerve from the side here, what I'm going to do is I'm going to bring my elbow out to my side. My elbow should be directly in line with my shoulder. I'm going to rotate where my forearm, elbow, and shoulder are now in a straight line. And then I'm going to work on extending my wrist. And then from there, I'm going to bring my arm straight. So I'm coming right at the camera. So you can see that I'm in a straight line and wrist extension. Not supporting my arm like I just demonstrated there is going to be the harder version. So if you have a really hard time getting your shoulder back in that position, you can also bring your elbow slightly in front of your shoulder. So there's not as much cramping that goes on trying to maintain that rotated position. So if I were to do that seated here without the support, again, I'm going to bring my elbow straight out from my side. I'm going to rotate my forearm to where it's in line. I'm going to extend my wrist, and I'm going to reach straight out. So that's the motion that we're going for. Now, if we're doing a flossing, as my arm goes out, my ear is going to come toward my shoulder. And again, this is the flossing motion. If I'm doing tensioning, as my arm goes out, my ear is going to go toward the opposite shoulder. And I'm going to feel more of a pull when I do the tensioning. And typically what we'll ask of you is to hold that position for about 2 seconds. Now the reason I like to use the elbow support is because it puts load where I want it. And that way the muscles in the shoulder aren't trying to be super active, or some of you maybe have limitations in range of motion, you can't even get into that position. So if we prop your elbow up, I can actually bring my elbow slightly in front of my torso, so I don't have to have as much motion to get back there. Then I can rotate my hand, go into extension, and then I can just simply from there straighten it. Now if I'm doing the flossing, remember that as my arm goes straight, my ear goes toward the same shoulder. If I'm doing the tensioning, as my arm goes straight, my ear goes toward the opposite shoulder. If I don't feel much of a stretch, I can scoot my arm back a little bit further, have the exact same setup, flossing, ear to the same side, tensioning, opposite ear to the opposite side. And the idea here is you're going to feel that pull through your forearm. And as you do go through your reps, you should feel that the stretch within the same range of motion goes away, or the stretch stays the same, but you're able to move through a greater range of motion.